Welcome to the CraftsWombman channel.
Okay, can you hear me now? Aremisa, can you
Yeah, I can hear you just fine.
Okay, thank you so much for accepting the call with trauma or whatever is on your heart that you'd like to talk about.
Oh, okay. Well, first of all, I just want to thank you, sis, for definitely having me on. And, when you initially messaged me, of course, I was honored to do it because, I love my sisters and I definitely love you. And I'm just so, in awe at the work that you're doing. It's absolutely amazing. So I'm just happy to be a part of your journey as you kind of introduce health and wellness to other women who may not know different variations of how they can heal themselves. So you wanted to speak in regards to womb trauma. Well, I will tell you just a little bit about my own work as a womb healing specialist, or I either call myself a womb healing specialist or womb health coach. I kind of use those two terms interchangeably. And basically what I do with women, I work from both ends of the spectrum, from the emotional as well as the physical. My main concentration as it pertains to herbal therapy is hormone balancing. I'm very much fascinated by the endocrine system, and having gone through my own hormonal issues as a teenager and young adult, and that's something that's very kind of near to me, and so that's kind of the way that I move as far as the herbal therapy work. As far as womb trauma is concerned, with my life coaching, I work with women through various degrees of womb trauma. In my practice, I identify four particular categories of womb trauma. All of those being pregnancy and childbirth. That's one category. Sexual trauma, womb disease, and emotional trauma, such as, divorce, heartbreak, mother-father issues, the death of a child, that sort of thing. And just to kind of break it down even further, with pregnancy and childbirth, of course, that includes anything related to miscarriage, anything related to any type of birth trauma that, women may have gone through, because we know that birth trauma is it's something that wasn't talked about before, but we're finding now that many women are opening up about their traumatic experiences during birth. And this could be anything from an episiotomy to something that, they didn't ask for, something that they weren't informed about. It could be anything that a woman deems as trauma, which I think we should probably take a look at as well as to what trauma is. And trauma is can be considered any event or situation that can be physical or something that has happened to someone that impacts them on an emotional level. And so when we speak in regards to womb trauma, we're speaking of something that may have happened that is impacting this woman or any woman from an emotional standpoint. And so, when we talk about, birth trauma, we're talking about anything that has happened that is still impacting her from that emotional standpoint. Same thing with pregnancy, whether it be, miscarriage, stillbirth, abortion, any type of traumatic experience. And so it's not really up to us to determine what is traumatic. A woman or anyone can determine what is traumatic for them. And if it is something that is still affecting them after the event has happened, then that can be considered a traumatic experience. And, I don't know if you want me to kind of focus a little bit on birth trauma. I can definitely stay there, or we can kind of go into the stages, however you'd like me to flow, sis.
You can go ahead. I mean, I have some questions, but go ahead and just go.
Mm-hmm.
Yeah, you can go. Let's
okay.
All
right. Yes, ma'am. All right. Well, I appreciate that. So in regards to trauma as it relates to pregnancy, childbirth, and then, of course, sexual trauma can be anything from molestation to rape to STDs even, which I would actually put those in either the sexual trauma category or even the womb disease. Womb disease is anything from fibroids to, to PCOS, to, again, sexually transmitted diseases, even yeast infections or any type of surgery, anything like that. A hysterectomy even could be considered womb disease or womb trauma. Emotional trauma, this is a little bit different for some people because they may not always associate it, but when I explain it, it makes more sense. I have this way I like to deal with things called the womb-heart connection. And some people will consider the womb the second heart. Some people, kind of associate it in that way. And the reason why is because when a woman is impacted in her heart, that's where she feels it, right? But the womb is where she actually experiences it. And so whenever something has happened, there's some sort of traumatic experience that has happened, she feels it in her heart, but then it actually is experienced in her womb. And this is where we find much of the womb disease. And the womb will always tell what the heart is feeling, right? So the womb will tell in way of, the amount of discharge that she has, the heavy bleeding that she may or may not have, the lack of bleeding that she has each month, or whatever the case, infections, things like that. And there's always that emotional connection. And so sometimes that is due to, again, like we said, broken heart, divorce, the effects of the traumatic experience, losing a child, mommy and daddy issues, all of these different things that can impact the heart and the impact the womb. So that's my fourth category as far as the emotional trauma, that womb-heart connection. And so when those are out of balance, then we have a whole host of problems. One of the other things that I wanted to say about these particular categories of womb trauma is that in a woman's lifetime, she will have experienced 9 times out of 10 more than one. So where I like to kind of work with women at is trying to identify where did this particular source of the womb trauma begin, and, kind of start there so that we can begin to start the journey of healing so that we don't encounter any more womb traumas or issues. So say, for instance, if there was a history of sexual abuse in a woman's life, and for whatever reason she had not healed from that, or certain things had not been uncovered, or it's something that she hid, 9 times out of 10 she's going to have, cramps or PMS or something to that effect in her adolescence, in her growing years during her moon time. That's another form of womb trauma. So now, by the time she's 15, 16 years old, she's gone through molestation at an early age, and now she's gone through, PMS issues or things pertaining to her moon time, hormonal imbalance. And then this could cause other things like miscarriage and different things like that. So there's a repeated trauma that can take place that can impact a woman heavily. And if those things are still sitting in the cellular body of her womb, then the likelihood of her, healing is going to be, it's really not going to be good. So this is why we have, we have all of these different issues as women, because, and they're impacting relationships, and men can have womb trauma too, because they come from the womb, right? And so if they have issues with the women in their own lives, a lot of times that is their introduction to womb trauma, and so now they've experienced some variation of it, if that makes sense.
Yes. So what's your womb story? Like, how did you come into being a birth doula and into this womb healing?
Mm-hmm. That's a very good question, because I'm a firm believer that, we kind of tap into whatever it is that we've gone through in our lives, right? So whatever it is that we have dealt with, a lot of times we want to, it's either been, so good or so bad that we don't want to see people go through it, or if it's been good, then we want to help people get there, right? And so, and I believe that that's a lot of our stories as far as it pertains to birth work too. I myself have had situations of of miscarriage and different birth situations that really did take a toll on myself and my family. However, I knew I didn't want another woman to have to deal with that. I didn't know to what capacity I was going to be doing this work, and it just started out as my midwife basically saying, well, there are not enough African-American doulas in the DFW area, but I knew that was not my calling. I didn't feel that midwifery, I didn't know it then, but, I was kind of battling with that. And one of the is that your story too? Yeah, and so for me, go ahead.
Oh, no, I'm listening.
Oh, okay. I was just saying for me, I felt like it was a toss-up between childbirth education and becoming a birth doula. And I contacted 2 organizations. I don't remember my journey as a birth doula. I also began to see different emotional ties to birth. And I know that back then, I don't think, it was a fact that there was an emotional impact on a woman's birth experience, but I don't think that it was well versed. I don't think people knew as much about it because we didn't talk about it as much in the birth circles that I was in back then. And so, but I knew I began to see this pattern of women who were having difficulty grasping the fact that they could have a peaceful birth experience. And there was blockage. There was a lot of blockage. It may not even have been their own. It may have been their mother's blockage. It could have been someone else's. So I said, there's got to be more to this. And it was to the point where no matter what we did, fear clearing and all of these different meditations, there was nothing that was remedying their anxiety about giving birth. And so that's when I wanted to kind of take a deeper look into the emotional wellness of women. And then, of course, having had children and, kind of understanding that emotional part and the postpartum and different things like that. And so I definitely knew that there was a connection, and of course for me being a woman of African descent, I wanted to take it even further and try to figure out ancestrally, from that perspective, what does the emotional space look like for a woman of African descent giving birth? What does that look like? So, of course, I started peeling back layers and doing a lot of research and, found all of these different connections between the ancestral world and how we carry over things and DNA and whatever else have you. But to sum it all up, I knew I wanted to help women on that emotional level as well, because I knew that there were certain things that I had gone through with my own womb trauma as far as, and different things like that. And it wasn't enough to just be able to provide comfort measures for me. And so being able to understand it from a deeper level, I soon after, 3 years ago, I became a life coach specializing in emotional health and wellness, and worked with, a very, very wonderful mentor, had some great training, and so I've been doing that ever since. And then, of course, having had, hormonal issues as a child with PMS and different things like that, that's something that's always been, very emotional health and wellness, all that good stuff. So that's kind of how it came to fruition.
Okay, so what would be your advice if someone is trying to heal from an abortion?
Well, one of the things that I've come to understand in working with women is that there's different variations of emotion women go through when it comes to their, to their traumatic experiences. And some women, even though, there's different areas of how people look at abortion, some women are very much okay with the fact that they had one. Some women are okay with the fact that they had one, but they may be worried about how people will view them. So I think definitely taking a look at what it is that you really feel about the situation, about how does it make you feel. First of all, identifying your reasons as to why you made the decision. If you're very clear on that and you understand that, or if the decision was made for you, and also making sure that, you are, that you resonate with what it is that you did. Did you resonate with it? Did it feel okay for you to make that particular decision? Did it feel okay to you? And if it's something that women can honestly answer, if they can say that they felt okay at the time, but then afterwards, those are different ways we need to deal with those things. One of the things that I like to help women understand is, not only do you have to take care of yourself emotionally after a big decision like that, but you also have to take care of yourself physically. So, there's always going to be, because if you begin to feel bad about the decision that you make, and don't get me wrong, I'm not saying whether or not it's right, wrong, good, bad, because that's not my decision. My job is to help you to be able to kind of move past that part of the emotion, so that we can kind of use it for something else. And what we're doing is we're taking that pain and we're using it for power, so that we can use it for our purpose. And it's really about being at peace with whatever decision was made. And I think that's the point that we need to make in a situation like abortion, is like, are we at peace with what the situation that was made or the decision that was made. And if we aren't, how can we get there? Because, again, we're not only having to deal with the emotional aspect, but if you've had all of these different feelings that have been weighing you down for such a long time, then 9 times out of 10 you probably haven't been taking care of yourself physically too. So not only do we have to take care of ourselves emotionally, but we got to take care of ourselves physically as well. So I would definitely, for anyone dealing with that particular type of trauma, start there. Beginning to identify exactly how you feel about it. And then on top of that, begin to understand how you feel about how other people may feel about it. Because we have a lot of people that, a lot of women who are, like I say, they may feel at peace with their decision, but they may not have told anybody because of how people view that particular topic. It can be such a touchy topic for so many people. And so they may keep it quiet. And just the fact that they kept it quiet, it can burn them up inside. And so, again, we have to look at the varying degrees at which that particular decision is being made and how it has impacted them, if that makes sense.
Yes, and what would be the difference in healing from a miscarriage?
I don't think there's a difference. I think because and the reason why I say that is because the steps are pretty much the same. You're identifying exactly what has taken place, right? You're identifying it in your trust, because at the end of the day, we're still trying to find peace with the situation at hand, right? Even if it's a miscarriage, we're trying to find peace with it. We're trying to, because, a lot of times the question is why? Why did it happen? And one of the things that I definitely recommend in the case of a miscarriage even is really, really understand from a physical and a medical standpoint why it happened. Get copies of your records, of your hospital records, so that you can begin to understand, so that you can kind of see where, from a physical standpoint or a medical standpoint, where you can kind of begin to make some different changes, because that was something that I had to do. I had to literally get my copies of my records so that I could see what was going on, because they don't tell you in situations like that. They don't tell you. And so that would definitely be number, that I would suggest. And then also, too, taking care of yourself. And this goes across the board, and I don't mean like, go get your hair done, go get your nails done, but really pouring into yourself, giving yourself that love and support that you need, because, a lot of times what will end up happening is we're looking for other people to understand our plight, and we may not, they may not understand. A lot of people don't know what to say after someone has had a miscarriage. They may not know what to say after someone has had an abortion or any kind of traumatic experience. So you have to learn how to love and pour into yourself as much as possible. And, one of the things that has always worked for me has been ritual. Ritual is such an amazing component to our health and wellness. And it doesn't have to be elaborate. Ritual is something we do on a regular basis to nourish ourselves, to nourish us from a physical, emotional, mental standpoint. Taking a shower is a ritual, or a cup of coffee or tea in the morning, ritual. But it has to be something that you do that is going to balance you and center you, and definitely be around people who are supportive. Be around individuals, women, who can share their stories in a positive light. Because, again, this is stuff that we just kind of deem as normal. Abortion, we've normalized it. We've normalized abortion. We've normalized miscarriage. And not to say that, it's neither good or bad in any sense of the word. However, we've made this a part of, they lost a baby and it's no big deal. But knowing that people go through these varying emotions that sometimes, are too hard to handle, that are too tough to handle. And so we have to be this supportive force for women when they go through these different things.
Okay. And, like we're talking about self-love. What's an example? How do we know that we really love ourselves? Everybody always say love yourself. How do you know that?
Yeah.
How do you know?
How do you know you love yourself? One of the things that I think, and I've talked about this, is one of the ways that you know that you love yourself is when you can give and not sacrifice. And when I say that, when we give because we have it to give, right? But when we sacrifice and we need it back, right? And I can give to my sisters because I've given to myself. We can give as birth workers because we've done what it takes to nourish ourselves and give to ourselves. That's self-love right there, where you can give to yourself and you can nourish yourself and you can look in the mirror without, that doubt and that fear. That's given to yourself. It's like if I give you, sis, you say, oh, sis, can I borrow $5? And I say, well, yeah, but I'm going to need that $5 back. I'm sacrificing because I really don't have it to give to you. But if I say, if you ask me for $5 and I say, sis, go ahead on. Don't you only have to worry about paying me back. That's me giving because I already got that $5. I got, $200 more, whatever the case may be. And that's how it works with our emotional selves too. You cannot give from that empty cup. You cannot give from a base of it's like drinking with a hole in your cup. You can't drink with that hole in your cup. Your cup needs to be full. And so when you can give, when you can truly, truly give and not sacrifice because you need it back, when you can love someone for the sake of loving them because you've given love to yourself, it doesn't even matter if they love you back. You love because you would love to love, for them to love you back, of course. But, you know that your love is a gift to them. That's how you know that you loved yourself.
Mhm. Okay. Let me ask you a question about some herbs really quick. What are, like for fertility, can you just name off about 3 good herbs that you generally recommend for fertility?
Yeah, for fertility. I like chaste tree. If there's anyone from my women's herbal intensives, they know that chaste, my spirit herb. I'm a huge fan of chaste tree. Let's see, ashwagandha is another good one. And let's see, ashwagandha, chaste tree, and probably I'm trying to think of some ones that I normally use. Those are my 2 top ones, to be honest with you. But I like Damiana. Damiana is a great aphrodisiac, which increases fertility, and it also relaxes. So I like those 3. Those would probably be my top 3. And then there's some other ones like that actually help to balance the hormones.
What
fibroids?
About fibroids?
And I would tell you. Yeah, and I would tell you with fibroids, one of the things that, we have to take into consideration with fibroids is like a process. There's the process of also detoxing the liver and the and the intestines and being able to nourish and really I don't like to use the word detox, but nourish the liver and the intestines. And then nourishing the womb as well. And so, I don't recommend heavy phytoestrogen herbs, such as, your red raspberry, flaxseed, and things like that. But I like to start with actually nourishing the liver first, because I find that once the liver is nourished, once the digestive system is nourished, then a lot of times those fibroids will begin to shrink on their own. But also, too, herbs that are going to actually shrink the fibroids and actually tone the uterus. And actually red raspberry is a good one for that. Some women will find that red raspberry is a little aggravating for the fibroids, which, definitely can be true. But also 2 hormone balancing herbs, some of the ones that we mentioned. I wouldn't use chaste tree for fibroids per se, but you could use like an ashwagandha. You could use like rhodiola, some of those that will actually help to balance the hormones as well.
Okay, thank you for a little bit of herbal knowledge. I got to cover it
into consideration because I don't know your health history or anything. But, of course, your diet, like you said, your stress levels. And one of the things that we have to understand is that we need some circulation to the womb whenever we have any kind of fibroids or cysts, because that's nothing but congestion in the womb. And so what you can definitely begin to nourish your body in those ways. Like I said, I don't know what all you have been doing in particular areas as well, but that's going to definitely, cut down on them coming back significantly if you are, if you actually cut out, sugar, and especially sugar. Sugar does nothing, absolutely nothing but agitate the womb. And so those are some things that you definitely want to take into consideration. Sugar, dairy, any types of saturated fat, things like that that are not actually, benefiting your body in any way, have no nutritional value. Definitely up your leafy greens if you can, and let's get some circulation to your womb, whether it be womb yoga, whether it be dance, something to kind of assist in that area. You can also take simple herbs like ginger, will actually bring a lot of circulation. You can do, I'm trying to think of some other, well, ginger is actually the number one I'm thinking of. Dong Quai is a good one as well. That would help. But I don't think that particular herb, taking that herb would be too harsh on the body. But I think also, too, being able to, because one of the things that we have to understand is that if we don't want it to come back, we got to start taking these preventive measures as far as, our diet and our overall lifestyle is concerned. Because when I work with women, a lot of times the last thing that I even will suggest is herbal therapy, just because of the simple fact that, I need to take a look at the entire lifestyle. How is your lifestyle impacting your health? And so if you can begin to kind of do those things to nourish your body, and then also, too, we got to think about our elimination. If we're going to the bathroom on a regular basis, all of these things play a factor into what we're doing. And so I would definitely begin to start there. As far as, your overall health and wealth, so that they don't come back. And then, once you're able to kind of get your hands back on the herbs, then, you can see about maybe taking them, a little bit at a time to kind of help you.
Can you tell us, how can we address this birth crisis that we have in this country?
First of all, we need to be at the forefront, making everyone aware, especially in our communities, our Black and brown communities. We have to be at the forefront, making everyone aware of what's going on in our communities. Education is key, and I know that many of us have definitely been on those front lines. We have been there, doing the work and pushing for it. But we have to begin to have certain systems in some kind of way. We have to begin to get that educational piece out there as far as the infant mortality rate. And I know this is Infant Mortality Awareness Month, and this is always a very difficult time because, again, we're also, while we're bringing awareness, we're also mourning the babies that did not see a year, and what have you. And so this is definitely a time where we need to educate. We need to educate women. One of the things that I always challenge some of the birth workers in my Women's Herbal Intensive is to begin to, if you can, offer some sort of preconception planning in your services, or add them to your services, so that we can begin to make parents aware of some of the dangers that are affecting the infant mortality rate and even the maternal mortality rate. We have to begin to make parents aware, so that and their family members as well, so that they can also speak on their behalf, because we know not everybody has a doula to be able to speak on their behalf. And so we have to not only educate the mother, but we also have to educate extended family members as well as to some of these things that are definitely going on in hospitals. And I mean, we don't have to sit here and name them. We know, but we know that there's a system that is really, really not helping as far as this is concerned. And so we need to have more people that are advocating for these families, that are advocating for these babies. There's also needs to be education at home as far as, making sure your children are well cared for. As far and we're seeing infant mortality is not just, babies are, health-wise dying, but also, accidents are happening. And so I think that that's a huge part of the educational process as well, too, encouraging mothers to continue to breastfeed, encouraging positive emotional health and wellness amongst our families, the men and women domestically. Domestic violence we know is another issue. And so these are all things that play into the family dynamic. And so we need to make the family dynamic continue to help make it stronger and stronger. So I think education is definitely key.
Okay. I also want to ask you, this is kind of like how I even got into being a doula. Didn't even know, all the terms and stuff. A lot of women were complaining that they were having cesareans unnecessary fact that they feel like like someone took the vaginal birth experience from them. How can they work towards getting healing from having a cesarean birth?
Mm-hmm. Yeah. That's a and this is too common of a story, unfortunately. And you're right. There is again, remember, I was saying back then we didn't know a lot of these different things. Now the terms, are being added to them. There's a name that's being added to these different traumatic experiences that's happening. And one of the things that women, first and foremost, because I talk to a lot of women who have had these situations, and even if they know that, it may not have been their fault, some kind of way, and speaking to them and in questioning, they feel like it was their fault. And so one of the first things is that you have to not blame yourself for this cesarean section or this birth rate, because a lot of them will. Well, maybe if I had done this wouldn't have happened, or maybe if I didn't go to the hospital, this wouldn't have happened. No, if it was not a medical emergency, then it should not have happened, period. And so understanding that it was not their fault is definitely the first step, because a lot of women who have had cesarean sections, who have gone through these different things, even episiotomies or whatever the case may be with these birth traumas, they feel like some kind of way it was their fault, or, my body just can't, give birth vaginally, or the doctor told me I was this, and they believe it and they internalize that. So the first thing that we have to do is not blame ourselves. And also, too, if we have blamed ourselves, begin that forgiveness process. Begin that forgiveness process. And also another thing, again, I'm going to keep going back to this, get copies of your medical records so that you can see exactly what was the reason why you told me why you decided to do this C-section, but I need to know what was it. And then, we can begin kind of that healing process, because I think that being able to see it on paper, being able to look at it and say, you know what, I'm not the one to blame for this, is definitely a good step towards the healing, because if not, then we'll continue to believe that lie that it was our fault. And so I think being able to understand that and then begin to empower yourself, because a lot of times, it's very hard to see the good in it, but who knows, maybe that particular reason or that particular situation, now you can help empower somebody else, because like I said in the beginning, that we all kind of come into the things that we do because of things that we've been through ourselves. So now what are we going to do with this information? And that's that, taking that pain, using it as power so that you can fulfill your purpose. So definitely those would be some of my first suggestions. And then, of course, getting deeper, because, again, everybody's going to be different as far as beginning the healing process. So.
Yes, that's true. I have somebody online who has a question about preeclampsia. What's the reason and how can it be avoided?
Okay, preeclampsia, during pregnancy. So that's basically a buildup of toxins in the body, and it can be identified usually with puffiness and high blood pressure and different things like that. One of the things, preeclampsia is really, really difficult because, again, it's something that, it can come on suddenly during pregnancy, and you have, almost no warning signs almost. But I think that one of the things that can help with that is to, again, this goes back to the whole idea of preconception planning and kind of nourishing the body prior to pregnancy, because again, preeclampsia can happen due to accumulation of toxins in the body. And so if we can begin to nourish ourselves prior to, or even in the beginning stages of pregnancy, making sure that we're eating right, we're nourishing ourselves. I always like to use nutrition with pregnancy because, again, so many different herbs, just like with medicines, women take pregnancy. So I always suggest, nourishing herbs such as alfalfa or nettles, even red raspberry, very nutritious herbs that contain a lot of calcium, that contain a lot of vitamins and minerals, because that's what your body is going to need in order to get rid of a lot of the toxins that are in the body, or, a lot of the unnecessary stuff that's in the body that can cause preeclampsia. So I always suggest from a nutritional standpoint, definitely nutritional herbs, nutrition.
Thank you so much for watching. Please like, share, subscribe, and leave a comment. Let us know, what did you think about this video?